Hi, it's Dr. Kenneth Yu, facial plastic surgeon here in San Antonio. I just want to take a few minutes to chat briefly about a liquid facelift. You may have heard this term either on the internet or various social media platforms and be wondering what that is. Facelifts can be a little scary because it is surgery and people have these perceptions of being disfigured and deformed, and so it's very natural for many people to want to delay or not go through surgery. But with aging, we'll see atrophy of your fat, your facial fat, descent of your fat pads, loss of elasticities. All those contribute to facial aging signs. And minimally invasive treatment options such as injectables are super popular in the US and in the world because it avoids surgery. And it's a quick procedure and you can do it in the clinic without any major downtime. So a liquid facelift, when you hear the term liquid, is really just using a substance to try to achieve some sort of rejuvenation. And today, with the different characteristics of all these various hyaluronic acid fillers, we can achieve pretty decent results with fillers. And so a liquid facelift, really, bottom line, is using fillers to try to rejuvenate your face and maybe achieve some slight degree of lifting. Now, in the early stages of fillers, and I think it's gotten a bad rap, people tend to try to keep filling an area of deflation, and so as you get older and older, you have more volume loss, and so you'll require more volume of fillers to try to refill. But if you think about that, sometimes that can lead to what we can see as an overfill look, and that's many times can be unnatural, and people, at least people who come to our practice, seem to comment that they're not interested in that look. However, in the last few years, I've noticed that due to the advances of these HA fillers from Juvederm, as well as Restylane companies, they have these different characteristics, and really a good liquid facelift is really trying to take advantage of different qualities of these fillers to try to lift rather than overfill the face. So liquid facelift is, in our practice, using the workhorse is Voluma. It's their highest G prime filler that can really go deep to the cheekbones, and really we're resuspending, we're actually lifting the soft tissue to some degree, trying to take advantage of the adhesive qualities of Voluma. But not only that, we're taking Voluma and Velour as well as Volbella. These products can, again, strategically used to suspend, lift certain areas, try to fill in relative depressions in your tear troughs, and just overall rejuvenate your face. Now, an off-label use too is using Voluma or Velour in the preauricular area. A lot of times that can sort of act like a glue in a way, to sort of put it bluntly, to try to tack your skin back a little bit. Now, it can't pull your skin back as much as surgery, obviously, but it's pretty amazing how the subtle effect it can do can really achieve a nice refreshed look for you. And so fillers are definitely very popular in our practice, and again, it's one of those things which avoids the fear of surgery. It is a in-clinic procedure that we can do in that same setting. The risks are bleeding and bruising, but those are pretty mild, I found, in our practice, and results can last reasonable time. The deeper injection, it tends to last close to a year and a half to 2 years, but when we use it in sort of contemporary, innovative ways in different areas of the face, such as the cheeks, because it's more superficial, we found that it may not last as long, perhaps maybe 4 to 6 months. But for patients who are not ready for surgery, this is a reasonable alternative, and they're willing to try that. If you have any interest in this, or if you want to see if you may be a candidate for liquid facelift, I invite you to call us, and we'll be happy to meet with you and see if you're a good candidate. All right, hope to hear from you soon.